We're live on location at Baptist MD Anderson Cancer Center here on the Medical Mile in San Marco, and we've learned so much through the morning, Christine, about the treatment and the level of care that's provided anytime there is a cancer diagnosis here in Jacksonville. And what's fascinating is very few doctors, which is okay because it does also speak to the holistic level of care that any patient can receive, whether it's breast cancer, prostate cancer, or anything in between, and all of it is so vital.
And here at Baptist MD Anderson Cancer Center, we had talked about taking a holistic approach to medical care. That means not just the actual clinical diagnosis, but all of the things that happen in somebody's life that contribute to not only their diagnoses, but their situation and help for assistance. So with that, we bring in an oncology social worker, Becky Ness. Good morning. Thanks for being here.
Good morning. Thank you for having me.
So why are support groups important for healing, and why is taking an overall picture of the person's health really important?
Absolutely. Support groups are pivotal in a patient's cancer experience, in my opinion, because it gives patients a chance to connect with one another, to feel like they're not alone in this, to really feel like there's a community around them. Of course, the providers here at Baptist MD Anderson provide wonderful medical care and support, but we also want our patients to feel that emotional and spiritual support as well. And so giving them the opportunity to connect with other patients going through the similar treatments, same diagnosis, struggling with the same side effects, really helps them feel like they have other people that understand, because it can be a very isolating time in the life. And so having support groups really helps normalize a lot of the feelings, validates a lot of the feelings, and kind of helps people make connections.
Does it give them more control or perceived control over their disease?
100% it does. You know, I feel like cancer and control is one of the things that I talk a lot about with our patients, because we go from planning our own time and schedule to now we're at the beck and call of office visits, labs, appointments, surgeries. So going to support groups and finding out and reminding people that while they can't control maybe their diagnosis, they can control their response to it, and really finding ways to take that control back and figuring out how other people have been successful with it helps them figure out, how can I do this within my own life and my own experience.
Do you work directly with the physicians and those who treat it and try to understand what the individual is going through and then kind of have it make sense to them? Or is it more focused on the individual and what they need in the moment?
It's both, actually. We work very closely with our providers and advanced care practitioners, our physician assistants and nurse practitioners. Sometimes they'll be like, hey, if something didn't seem like they might need some help, or they didn't really understand, or there's a concern about are they able to get treatment or afford their medications, because life doesn't stop when you get cancer. If you have those financial stressors or practical concerns before, it's going to become more distressing. So a lot of times we'll coordinate with the providers and be like, hey, I learned this, so can we look at consolidating their appointments so they're only making one trip downtown, right? Or can we look at generic options for medications? And then also providing the patient that individualized support and helping make sure they understand what's going on and seeing what their needs are. We really try to meet the patients with where they're at in terms of what they're feeling.
And is there counsel? Like, I'm thinking, for example, from a spouse's perspective, if my wife were to have a breast cancer diagnosis, in what ways can I best support her? What are the things that I can be doing now as the husband, vice versa, wife to husband?
Yeah. Sometimes it turns out that patients kind of feel like they have a decent handle on things once they get into a rhythm and a routine. And sometimes it's our caregivers, our family members, that tend to feel like they're falling apart, right? Because there's that dualness in the relationship where they want to be strong for their family, for their loved one going through cancer, and it doesn't really always create space for them to feel scared or overwhelmed. So we do provide a lot of support to the families and to the spouses and caregivers. I want to say a good question to always ask your loved one going through cancer treatment is, what does support look like to you right now? Do you just need someone to hold you while you're crying? Do you need someone to help you with a meal or get a ride to transportation? Support looks different for everyone, so just seeing where they're at. And also not isolating yourself in the experience, making sure you're reaching out to your peers or family and making those connections so cancer doesn't take control over your life as well. And we do have a caregiver support group as well, which is a great place for folks to connect and see, like, hey, how do we do this? How do we rally together without it becoming your own identity?
Do you see any correlation, and are there statistics that show any correlation between people who do have a stronger support structure and people who are, doing better at healing and things like that?
Yeah, I don't know the data quite off of hand, but there have been studies saying that having a better support system or community, can lead to better survivorship outcomes. Because one of the things that we want to be mindful of is the impact of stress on your body system, right? Because stress and cancer kind of correlate a little bit together. And so we really want patients who have more stressing episodes or have lots of socioeconomic things happening or a lot of other barriers to their care. Sometimes that prevents them from being able to fully concentrate on their treatment, can lead to some other health disparities that we see in this area and can really impact their long-term goals and survivorship.
How do you turn it off and not carry it home with you? I mean, some days are probably a lot harder than others.
Yes. We have a great team here, so I definitely utilize my team lead and our other social workers here to help. Also, I've been doing this over 10 years, so I've also just gotten very good naturally, I guess, at compartmentalizing and just, I have my drive home, battling traffic, and I listen to my music, and that's my time to kind of try to shift gears a little bit. And so I just try to stay present. A mantra I've developed throughout my career here and that I always am happy to share is, it is my honor and privilege to be on these journeys with other people, but it's not my journey at the same time. So I'm there, but I'm separate. And so trying to keep that boundary in place mentally for myself keeps me present and active with the patient, but not taking on their situation.
Yet knowing that you pour so much into someone's journey means so much when
Yes.
someone does get that diagnosis here. And you mentioned 10 years. We're here because it's the 10-year anniversary of Baptist MD Anderson Cancer Center in Jacksonville. Thank you for the visit this morning.
Thank you so much.
Look forward to hearing more from your journey along the way here. Becky Ness is oncology social worker here at Baptist MD Anderson, Jacksonville.